Welcome back. Infectious disease specialist Dr. Zain Chagla joins us just in time with all kinds of developments since our last conversation. We'll get to vaccines, but before the break, good morning, by the way. We were talking about 150 people in the province's intensive care units. You mentioned that last week. That's the threshold where non-COVID patients are impacted.
Yeah, and unfortunately, I think what we're seeing is this is regional, right? We still have capacity in many centers, including Hamilton, but in the hardest hit regions, the Greater Toronto area, Peel and Brampton, we're seeing capacities in hospitals that unfortunately mean slowdown of services, transfer of patients out, that type of thing. So I think we're starting to see the effects of it. It is unfortunate for the people that live in those regions where their care is going to be compromised a little bit. And the province is thankfully looking at ways to offload people from one place to another just to get that routine care done.
Then comes the modeling that will be released later today. We're hearing if current trends continue, 10,000 cases a day. Worst case scenario, with COVID fatigue kicking in, 60,000 cases. How dangerous of a situation are we in right now?
I mean, we look at 3% death of symptomatic cases. We're looking at, a significant amount of hospitalization. But even if you take 60,000 cases and you say 5% get hospitalized, that's 3,000 patients. That is enough to essentially wipe out a healthcare system. So, that's very dangerous numbers. And I hope that, knowing this being released and part of that public transparency, people really consider their actions in terms of what this means to the greater population, particularly with a publicly funded healthcare system.
And just what do you recommend? What do we need to do? What are the goalposts for reopening it?
Yeah, I mean, I think that's it. Like the province, and the federal government is really saying, here is what's going to happen if you increase the number of contacts in your daily life. You can get up to 60,000 cases. We need to go on a pathway where our contacts are being limited more and more and more, which is, good messaging coming from the fact that December 25th is slowly creeping up. The numbers are rising, and it's not reassuring that people are still gathering and leading to this type of transmission.
Let's shift from the bad news to the good. Since we last spoke, huge vaccine developments. I want to ask you, though, between two leading candidates, and Canada has bought doses for both, but with Pfizer and Moderna can be stored at a much lower temperature, minus 20, as opposed to the Pfizer, I believe it's minus 70. How does this impact in terms of deployment?
Yeah, I mean, again, I don't think we're going to necessarily pick one over the other. We'd rather have more than less. And so I think what you're going to see is places where that minus 70, minus 80 long-term requirement is reasonable. We're going to have probably Pfizer vaccine rolling out there, big healthcare centers that already, or research centers that already have this kind of infrastructure built in for that minus 70, minus 80 fridge. Whereas you're probably going to see more remote communities, harder to reach communities, more dense communities where the Moderna vaccine may be used. So I don't want to say this is a positive or negative. And remember, with our other vaccines, there are different brands that we use that have a similar mechanism. So this is probably going to be complementary from one place to another. It's just making that logic of where we roll out vaccine A versus where we roll out vaccine B.
And the news releases say 94.5% to 95% efficacy. Is there a difference between the clinical trials and real world?
Yeah, there always will be. And these clinical trials enroll, thankfully, a set number of patients between different ethnicities and different age groups, but they generally are healthy people. They're not our patients in long-term care facilities who are on multiple medications, who have dementia, who are transplants, who have cancer. Those were not included in the clinical trial. It's always important to note that as we move to real world settings, that efficacy sometimes can be lost. But hey, if it's 80% efficacy for prevention of disease and 80% for prevention of severe disease, that's still a whole lot better than we were a month ago.
Here's a question you may not be able to answer. We have seconds left, but do you have an idea or a window when we'll be saying, remember the pandemic?
I would say if the rollout happens soon, if the vaccines come in January, we might start breathing a sigh of relief by the summer. And I think next Christmas, we may have a relatively normal Christmas. Let's hope.
Okay. But this one's probably off the table, Christmas?
Yeah, I think so.
Yeah, okay. Well, have a good weekend.
Yeah,
Thank you,
you
Dr.
too.
Zain Chagla. All right.